Dr. Brennan, please tell us about the 3 or 4 most, severe and, like glaucoma, cataracts. Tell us about those illnesses, each one a little bit describing very shortly of what they really do to us and what is it as patients, the person who has the illness, what does he see, feel, or not see or feel in the case of eyes, I guess?
Well, let's start with cataracts.
Okay.
Cataracts tends to be an older age phenomena, although it is possible for a baby to be born with a cataract, but that's not too likely. The most typical onset is later in life. Earlier onsets for the late life kind could be in the 50s, though. My grandpa described his cataract like looking through cobwebs. And after my grandma had cataract surgery, she thought we had painted her walls while she was gone away for the day because things looked so much cleaner. A lot of cataracts give kind of a brown tint to your vision, and you don't even realize that your colors are dulling. And some people describe it like looking through a fog. You can't see very far away, and things look blurry like through a fog. By the time you get to the point where you're about not legal to drive anymore, that's where it's time for me to recommend cataract surgery, and I would refer patients to an ophthalmologist for that procedure and co-manage them before and after the procedure.
All right. So since we're on that subject, is cataract reversible? Like at an early or at a later stage? Is it something actually which is these days reversible, and what's the procedure called for that?
Cataract itself, that's a hard question, because there are some new studies that say that if you eat basically your fruits and veggies and have a rich diet in the antioxidant type vitamins, that in the early stages you may be able to reverse a cataract. But generally, cataracts become more mature. Sometimes we use the word ripe as time goes on, and the vision just continues to decrease. But if you're in an early stage, there is some evidence that you might be able to reverse it and improve your vision or keep it from getting bad as quickly.
With supplements, with the correct food, with antioxidants and stuff like that?
Antioxidants that I remember being mentioned would be like the vitamins A, C, and E primarily. Okay,
all right. Now what about the surgery? You mentioned surgery. Does that reverse it? Does that take that fog, that cobweb out, and it's gone?
Yeah, actually, surgery removes the natural lens of the eye, most of it, and then they replace that with a man-made lens called an IOL, intraocular lens. And that now focuses the light that your own lens used to focus, and it's clear. So it's not the end of the world. Usually you wouldn't stay blind because you developed a cataract if you get cataract surgery.
All right. So when you hear an advertising on radio, there's lots of like LASIK surgery, LASIK eye surgery. Is that type of surgery you're talking about it, or is that a different surgery?
That's a whole different surgery. LASIK is done on healthy eyes to correct nearsightedness, astigmatism, or farsightedness.
I see. We'll go and get into that in a different section. So, but there is cataract surgery available, and in most cases, or maybe in all cases, go ahead and tell me, it can be corrected, and it in the end is not the end of the world. Of course, you try not to get it to that level, and the only way to do that is eat correct food, and you might have a chance. Otherwise, are you telling me?
Oh, there's other things you might.
Right.
There's other things you might be able to do too, like protect your eyes from ultraviolet light. From a very, even from young ages, you should protect your eyes from ultraviolet light. Ultraviolet light is known to lead to old age cataracts, and it's best not smoke. Smokers will get cataracts at a younger age. So will diabetics get cataracts at a younger age. Certain cataracts are caused from injuries, so protecting your eyes from injuries would be good too.
Got it. Okay. Anything else about cataracts which maybe we should know? Something I haven't asked you.
Well, there's something cool about cataract surgery in the last couple years. Used to be you could only get your eyes fixed to make the distance clear or the near clear. And you might still need glasses to correct your astigmatism or the fact that you need a bifocal. Well, now you can pay for premium lenses and be able to have a better chance of not needing glasses at all after you're done. So even older people may not need to have a bifocal after cataract surgery if they choose some of the premium lens options.
Well, that is very interesting. That is definitely interesting. And the surgery in itself, any chance to just kind of like, the surgeon slipping and going, oops, we need to give you a marble glass eye and that's it for you?
I've never seen it happen. I'm sure it could, but I've never seen it happen.
All right. Good news. Thank you very much.
Yeah. You're welcome.